category of people of the Eora Nation. So today what I'm going to be whipping through or touching on is some of the advocacy issues that led up to the ministerial announcement. I'm going to be talking about improved access to HIV medications in a general sense, and I'm going to be talking about what the basis of the surveying that we've been doing with positive people both in New South Wales and around Australia, what that's actually being informed by. The results of the survey that was conducted by Positive Life New South Wales, NAPWA and Living Positive Victoria, survey findings, and then the training, resourcing and information needs, and then to actually touch on some of the challenges that we're going to be facing as a sector and as positive people as this rolls out or is implemented. So as everybody knows, there was a concerted effort for over a decade around in terms of policy implementation and having this change occur. From a policy perspective, as people know, in terms of policy formulation and implementation, sometimes there has to be policy windows, so the right time. And so what was the window in this moment was the lead up to IAS 2014 was the 7th National Strategy, and the Minister was looking for some type of policy win. So this is where the announcement actually came from. So I'd just like to dedicate this presentation to all the people who've advocated for years around the need for this change. I think it's an important issue. So under the 7th National Strategy, as people know, there's an increased treatment uptake by people with HIV to 90%. We've already surpassed that in New South Wales, so go POS people. I'm not sure what that means in other jurisdictions at this point in time, because in terms of data and implementation, against the 7th National Strategy, I'm not sure where that's at. So basically, this is around increasing people's access to HIV medication to ensure that treatment adherence and treatment options are improved across the board. Positive Life New South Wales was instructed by our funder to actually take a lead role in this as part of our funding agreement. So we set up a Access to HIV Medications Advisory Group, which has ASHM on it, has pharmacists from both hospital and private sector, has S100 prescribers, blah, 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 community representatives, and ACON is on that. So Brent Mackey from ACON is an active partner in this project. The other meetings that have been going on around the announcement has the Pharmaceutical Society of Australia has been partnering with the Pharmacy Guild and also ASHM to start looking at implementation from a prescribers and a dispensers perspective. So this is the quality standards for the National Safety and Quality Standards, and this is what the survey tools is actually based on. When I came into the job at Positive Life in New South Wales, I was asking around as a way in terms of quality improvement and in consumer consultation and engagement. I was looking for some type of framework or mechanism to actually start capturing that and documenting that as evidence to actually inform our practice and work. A colleague and friend of mine at RPA, Renee Morton, suggested that we actually base our approach and practice on Standard 2, and that's what this survey has been based on. So the 3 surveys that ran out from New South Wales, Victoria, and also from NAPWA nationally, they're the when they rolled out. So the NAPWA survey occurred in February this year. The New South Wales survey was conducted throughout October last year, and then the Victorian survey occurred in April. There's quite a difference between the New South Wales responses and the national responses in terms of the proportion of HIV positive people completing the survey and also the treatment uptake. This is basic demographics between a comparison between the national respondents and the New South Wales respondents. And the national respondents in general is much more representative of the positive population. New South Wales respondents was biased and led more toward HIV positive gay men, service and DSP dependent and attached. So in terms of the representative sample of the survey responses, the national survey was much more indicative of the fetal HIV population profile throughout Australia. In terms of the location where respondents actually came from for the different surveys, so there's a breakdown by jurisdiction for the national survey, a breakdown from the New South Wales survey, and then a breakdown from the Victorian survey. The graph or the table across the bottom gives you a little bit more detail about the number of positive people in general and the positive population distribution throughout jurisdictions, just to act as a bit of a comparison against the survey responses. In terms of treatment and care, this is just a little bit of some of the detail in the surveys themselves and where people are actually getting their care from in terms of respondents. Rates of people collecting heart from chemist as of the 1st of July. So this is the overwhelming confirmation that people with HIV want to get their drugs from a local chemist. When we went into this, we were estimating that it was roughly going to be around 30 to 40% of people would immediately take that up, and that was based on private-public prescriber splits within New South Wales. So we were pleasantly shocked and surprised around the difference in potential uptake of this change. So New South Wales basically is 65% of those that responded to this question, and the national survey gives you almost 80% uptake. When we fed this back to the Commonwealth at a meeting with the PSA, the Commonwealth they were shocked, so they almost shit their pants. So from their perspective, in terms of implementation, this actually increased the significance of making sure that this was sorted out and going to work before the 1st of July. So this is just a breakdown by state of what people were saying in terms of where they'll consider collecting their medications from and the reasons why people are going to be collecting their medications from a hospital pharmacy. So I'll just look through that. So that information then fed into a bit of resource development and communications plan around what we're going to be doing about this to inform people about the change and also deal with the change itself. So we've, in New South Wales, developed some resources, but unfortunately they've been held up by the Chief Health Officer as a result of the co-payment waiver announcement by the New South Wales government in the lead up to the election. So these resources unfortunately hadn't been distributed as was originally intended as of February, March this year because of that announcement. But what has been going on is there's continued development of training materials and resources, and there's been constant shout outs via Twitter, Facebook, websites, email to positive people and to service partners to let them know that this is going on. There's also been some stories in the gay press to let people know that this is going on and to inform them about what to expect. The PSA, in partnership with ASHM, are developing a pharmacist's information booklet, and they're also doing an online training, a webinar thing, and that's occurring in partnership with representatives from Victoria. In terms of the main tips or points that people with HIV need to be aware of as this is implemented, these are the main points that we came up with as an advisory group in response to the survey findings and the issues that were raised. In terms of pharmacists, these are the main issues in terms of structural implementation and what it's going to mean for dispensers and prescribers as the change occurs. The only issue that is yet to be finalised from a dispensing perspective is about supply, drug supply. So, and what I'm talking about that is that some of the pharma companies already have direct relationships or arrangements with drug wholesalers, and they're allowed to, as a result of that contract and that arrangement, they're allowed to supply those drugs to both private and public suppliers straight away. Other pharma companies, unfortunately, up until this point, haven't been operating through a wholesaler. So what that means is they're going to need to negotiate both with a wholesale company and the Commonwealth to be allowed to supply the drugs to local chemists. So, as I mentioned, there's some training that's going on. So there are 3 levels of training that I'm aware of for pharmacists. One of them is this training course that's occurring in Melbourne, or has been occurring in Melbourne, Brisbane and Sydney. So this is for hospital pharmacists to inform them about HIV and also the changes that are occurring. There's training that's occurring through the Pharmacy Guild of Australia. I'm not sure of the detail of that training. I haven't been exposed to those training materials or resources. But I've had confirmation and advice that that is occurring. And then there's the Ashland PSA online learning module that's in development and will be going live, I think, in June this year. So it's very exciting. It's good to know that pharmacists are going to be trained. The main issues from a POS person's perspective when we were conferring with people or consulting with people about this change was one, in terms of privacy and confidentiality and how people are actually going to be treated when they're going into a chemist and disclosing their HIV status. The second issue was around toxicity, drug interactions, that they wanted to make sure that the pharmacists knew about HIV and HIV medications and what the implications would be in terms of potential drug side effects and toxicities. So that were the 2 primary or principal issues. Primary issues from a POS person's perspective, and that was fed back into the training materials and resources as the priority areas. From a, I'm not that good with all the technical details, so in terms of all the content around pharmacy stuff, I let all the doctors and the pharmacists deal with that. But from a Commonwealth perspective, in terms of the funder's main issue was around stigma and discrimination. Infection control risk and what that means from a liability perspective for pharmacists and pharmacy staff. So it was really good sitting in the room with pharmacists, the Pharmacy Guild, PSA, ASHM, us as positive people, and community representatives, and the Commonwealth to actually have a very frank conversation about the implications of this and what this is actually going to mean. So that was very heartening to actually hear the Commonwealth say they want to make sure that positive people have as many options as possible to get their HIV medications, and it was also very heartening to hear them say they want to make sure that positive people are not stigmatised or discriminated against in any way as this is rolling out. Oh, again. Implementation challenges. So as I mentioned earlier, the survey reveals that there's a high level of interest from people living with HIV to make sure that they have the option to access their antiretrovirals from a chemist. I still have some concerns about what's occurring at a jurisdictional or a local level around this service arrangement and how this is actually going to be addressed to make sure that POS people are actually getting their needs met and aren't going to experience too much trauma as this is rolling out, because for some people this will be quite traumatic, going into a local chemist and then being told that they can't get their drugs from that provider. How hospital pharmacies and community pharmacists working together to identify local chemists and pharmacy uptake, and the issue around stigma, discrimination and prejudice. We know that there is going to be damage, we know that there is going to be some problems as this rolls out, and in the training materials or the education materials that I showed earlier in terms of the print and online resources, we have a section in there around how to lodge complaints to make sure that if someone's privacy is breached or they're unhappy with the service that they're actually getting from a local chemist, that people know what to do about it. So I guess I want to throw it over to you as a group now in terms of what you think about the implementation challenges, or if you have any questions arising as a result of this change.
Thank you, that was great. Let's just kick off with one question. So it's just about it being held up in New South Wales because of the government announcement at the election about the waiver. So is the complication from the Chief Health Officer's perspective about whether there's going to be a cost implication?
No.
Okay.
No. So it's purely about, she didn't want, so this isn't them being purposefully obstructive in any way. It was just about, she saw this as being, so when I say she, I mean Dr. Kerry Chan. Kerry was hoping that the administrative issues around the co-payment waiver would be sorted out sooner rather than later, and she wanted us to try and use the print and electronic resources as a way to actually inform people about the implications for the co-payment waiver. So it was purely just trying to synergise a communications exercise from the co-payment waiver perspective as well as the dispensing of HIV medications. So in Kerry's defence now, we put the resources and the resource approval up twice, because in New South Wales we can't actually do any print resources unless we get ministerial approval. So we've now put it up for a second time, and that's working its way through the health bureaucracy to make sure that we can get these materials out to the community.
Bridget.
Thanks, Craig. That's fantastic, and congratulations. It's a really important achievement. I don't understand how the waiver works. Can you explain? Because I thought the drugs were Commonwealth funded, but clearly the state can have the waiver. And how does it work? Can you explain it?
So I'll answer one question about the waiver, but then I want to focus on implementation of this change in terms of dispensing of drugs, because I think that's the more important issue. What occurs in terms of co-payments itself across the country, there's quite a lot of diversity or difference within the jurisdictions around where co-payments are applied and where they're not applied. So we know of 2 jurisdictions that already don't have any co-payments in place. New South Wales will be the 3rd jurisdiction. And Victoria is in a situation, so I'm not that familiar with the Victoria system, where there is no co-payment applied for drugs actually dispensed through one of the hospital pharmacies there. So it's discretionary, basically, and it's actually applied by the jurisdictions. So the co-payment issue within New South Wales is actually a New South Wales levy or charge, which is a way of the health system generating revenue. So the co-payment issue is actually a discretionary and state by state or a jurisdictional application and issue. When this came up at the PSA meeting with the Commonwealth, love PSA, love the Commonwealth at this point in time around this issue, it's very exciting. The Commonwealth was very clear. The Commonwealth said that they don't want any administrative charge placed on the dispensing of HIV medication through local chemists, and because they don't want that to actually create an access barrier to the medication. So the Commonwealth is very clear they don't want any additional charges placed on the medications at all as this is rolling out. Likewise, there is an obligation. If somebody turns up to a service and asks for their medication, there is an obligation for that service provider to provide that medication. Even though this is an opt-in scenario at this point in time around the dispensing of HIV medications through a local chemist, there actually is legally an obligation on that service provider to provide that service.
Yeah, Craig, again, congratulations. And just on a practical implementation level, I was interested and pleased to see that there are these complaint advice referrals in that brochure. I'm just curious, are they general kind of, this is the Privacy Commissioner, or are they, is there any option for like a specific, if the Commonwealth is supportive, like hotline or something? Because I worked previously in privacy protection and I know it can be very slow. So I'm just wondering what referrals there are.
So the more immediate response to that would be to actually approach, for example, the AIDS Council, the POSORG within the jurisdiction, to approach PSA or ASHM directly to actually try and get some type of intervention sooner rather than later, or some type of response to manage the issue. I agree with you, the higher level privacy or complaints process is a little bit sort of clunky and not always responsive in a timely manner. So there are other options, and we need to be communicating those to people in a general sense.
Sure.
Just a comment that we've had this operating in New Zealand for about a decade now, and it essentially runs incredibly smoothly. So I guess if you need any assistance to sort of look at what the issues might be and how they might or might not pan out, by all means seek information from our experience.
Fantastic. I'll give you a call.
Great, thanks, Sean. Linda.
Yeah, mine's kind of a double-barrel question. You mentioned that there have been discussions with the Pharmacists Association, or whatever it's called, about particularly about infection control, and I'm wondering one would hope and imagine that pharmacists would have a pretty good understanding of transmission of HIV and that there's actually no cause for concern with dispensing of drugs in the chemist to people with HIV. And the other part of my question, well, it's about remote, regional, small communities where people really have no choice of chemist and may well know that chemist really, really well. And there are obviously, which you would have looked at, particular issues for people in those small communities and wondering what choice they can have to have their prescription filled in some other way.
Okay. So, yeah, both good questions. The first issue regarding infection control and the levels of knowledge within health professionals, doctors, nurses, pharmacists around HIV transmission risk. When that was raised by the Commonwealth, I got the shits, quite frankly, sorry, I'm about to swear. And I made a bit of an inappropriate off-the-cuff joke, which is most like me, saying, well, what's the pharmacist going to do? Drag the positive person into the back lane while you're fucking without a condom. Because I thought this was a really, I find it offensive as a positive person that in today's day and age that we're still having this conversation. When you look at some of the research that's occurring and the assessment that's occurring of new grade nurses and doctors and pharmacists coming out of university, in terms of their basic understanding of around bloodborne viruses and STIs, in particular HIV and hepatitis C, it's really bad. It's really, really atrocious. That's where, so it's less than 50% in terms of when they're asked basic questions around how the virus is transmitted, that typically they only get a response rate of 40 to 50% correct. And so that's from new grads coming out of university. So there is an information or a knowledge gap within health professionals around infectious diseases, in particular HIV and hepatitis C. And that has significant implications then for how health professionals interact with us as a positive community or a positive population. Back to the issue around local communities in regional and rural areas. That was one of the things. Other than the survey process in New South Wales, what we did, we also went around the state and we ran about 3 or 4 focus groups or conversations with POS people to try and find out from a rural regional area what the implications of this could be, because we thought from a survey perspective, not everybody wants to put things in writing in a survey, and we thought we weren't going to get a representative sample. The implications for people in small communities, in rural regional areas, in particular Aboriginal people or heterosexual people living with HIV, they're very, very highly concerned around the privacy issues and what that means for people within their local community to actually find out about this. There's 2 solutions around that, well 3 actually. One is to maintain their existing arrangement around pharmacy supply of HIV drugs. 2 is to actually go to another town that's not too far away, where people so much don't know about their information, so they're not having to travel too far to go to the hospital, but there's still an opportunity to be able to get it from a local chemist. The 3rd solution is the online option. There's some suggestions in the electronic and print resources that people need to be looking and exploring the ordering of their HIV medications through online pharmacies. When we were developing the print and electronic resources for New South Wales and in general, we wanted to have more explicit information in there around online options and also negotiation with local chemists and also hospital pharmacies around delivery, so home delivery. But unfortunately, we were encouraged not to go into too much detail about that.
Other comments?
Yep.
Craig, I'm not sure if you can comment specifically on Tasmania, but it was raised at one of the policy officer meetings that there's something with the new public health laws there and concern about basically pharmacies sharing information about people who would access community dispensing. I know that's a little bit unspecific, but I don't know if anyone else you could clarify or if you know something about
It's
that.
about with the change, with the repeal of the 1993
Preventive Measures Act, the names were decoded when notification was made, and with that repeal and becoming part of the Public Health Act, those notifications will now be by name, like with other infections, and there was a concern that pharmacies would have access to that information. And everybody, not only the pharmacists themselves, but all staff in pharmacies would have access to that information, and the department just held off the decoding until they can be clarified.
So talking about next steps rather than just the implementation challenges, next steps is in New South Wales, we've undertaken with the Access to HIV Medications Advisory Group, we've undertaken to actually run the survey again in October this year to actually do a pre and post policy change surveying of positive people to see what the issues have been around implementation for them or getting their drugs from a local chemist, and if the rates of uptake were consistent with the findings last October. So we will do a follow-up survey of people just to try and do a double check and to see if there are other issues that we do need to take into consideration now it's gone live. So from an evaluation perspective, I think that's a really important thing. I'm not exactly sure yet with NAPWA and NAPWA's business plan for this year, if NAPWA will likewise repeat the national survey, but I don't imagine it would be too onerous or difficult to do so.
Great, thank you. That was great. Thank you. Okay, let me invite up Graham Brown, who many of us know, Senior Research Fellow at Archers.